Welcome to our deep dive into topical analgesics, a rapidly growing area in pain management. Topical analgesics are medications applied directly to the skin to relieve pain, offering an alternative to oral drugs. They are used for a variety of acute and chronic pain conditions, including osteoarthritis, muscle strains, and neuropathic pain. With advancements in formulation technology, these medications now provide better penetration through the skin, targeting affected tissues more effectively. Today, we'll explore how topical analgesics work, their benefits, limitations, and the latest guidelines supporting their use. Let's begin by understanding what makes topical analgesics unique in the world of pain relief. Topical analgesics encompass a wide range of prescription and over-the-counter products. These include creams, gels, sprays, foams, patches, and ointments. Unlike oral medications, topical agents are applied directly over the painful area, allowing the medication to act locally on tissues such as ligaments, joints, and muscles. This targeted approach often results in fewer systemic side effects. Common conditions treated with topical analgesics include osteoarthritis, musculoskeletal injuries, and neuropathic pain syndromes like diabetic neuropathy and postherpetic neuralgia. Over-the-counter heat and cold products are also popular for daily soft tissue pain relief. Use of topical analgesics has grown significantly over the past 2 decades. In 2000, they accounted for just 6% of the U.S. analgesic market. By 2007, spending on pain medications in the U.S. reached $17.8 billion, with topical products representing a notable share. This growth is driven by the need for safer pain management options, especially for patients who experience side effects from oral medication. Topical analgesics are now recognized as a valuable tool in patient-centered treatment programs, often used alongside non-pharmacologic interventions such as physical therapy and exercise. Topical analgesics target pain by acting directly on peripheral tissues beneath the skin. For example, non-steroidal anti-inflammatory drugs NSAIDs inhibit the cyclooxygenase COX enzyme, reducing inflammation and pain. There are 2 main COX isoforms, COX-1 which has protective effects and COX-2 which is involved in inflammation. Neuropathic pain is addressed by targeting symptoms like allodynia and hyperalgesia, often through mechanisms involving sodium channels and heat receptors. By focusing on these pathways, topical analgesics can provide effective relief with minimal systemic absorption. It's important to distinguish between topical and transdermal drug delivery. Both involve applying medication to the skin, but their goals differ. Topical agents are designed to act locally, targeting tissues just beneath the skin, such as joints and muscles. Transdermal systems like nicotine or hormone patches aim for systemic absorption, delivering medication throughout the body. Topical formulations come in various forms: solutions, sprays, gels, and patches, each tailored for specific conditions. Understanding these differences helps clinicians choose the right approach for each patient's needs. Topical analgesics offer several advantages over oral medications. They bypass the digestive system, avoiding first-pass metabolism and reducing the risk of gastrointestinal and cardiac side effects. Because the medication acts locally, there are fewer peaks and troughs in drug levels, leading to more consistent pain control. Topical agents are also easy to use and can be combined with other therapies. These benefits make them especially appealing for older adults and patients with multiple health conditions who may be at higher risk for adverse effects from oral drugs. Despite their benefits, topical analgesics have some limitations. The skin's outer layer, the stratum corneum, is a strong barrier, making it difficult for many drugs to penetrate. Only molecules with certain properties, such as low molecular weight and balanced lipid and water solubility, can effectively reach deeper tissues. Patient variability in skin permeability and the potential for local skin irritation are additional concerns. Researchers are developing new formulations like nanoemulsions and flexible vesicles to enhance drug delivery and stability. Effectiveness of topical analgesics depends on their ability to penetrate the skin and reach target tissues. Studies show that topical NSAIDs achieve much lower blood levels than oral forms, reducing systemic risks. However, they can deliver higher concentrations to local tissues, such as joints and muscles. Enhancers like liposomes, nanocarriers, and lecithin organogels are being studied to improve absorption. The ideal topical agent is small, both hydrophobic and hydrophilic, and stable in various formulations, ensuring maximum benefit with minimal side effects. Topical analgesics are generally safe. Some can cause photosensitivity reactions, skin responses triggered by sunlight. This is particularly true for certain NSAIDs like ketoprofen, pyroxicam, and diclofenac. Such reactions are rare but can be severe, so many topical products are packaged in light protective containers. Patients using these medications should be aware of the risk and take precautions, such as avoiding excessive sun exposure on treated areas. Recent treatment guidelines from U.S. and international organizations increasingly recommend topical analgesics for specific conditions. For example, the American Academy of Orthopedic Surgeons and the Osteoarthritis Research Society International both support topical NSAIDs for knee osteoarthritis. The National Institute for Health and Care Excellence recommends them as a second-line option after lifestyle intervention. These guidelines highlight the improved efficacy and safety of topical agents, especially for patients who cannot tolerate oral medications. Topical NSAIDs are among the most widely used topical analgesics. In the U.S., all FDA-approved topical NSAIDs are diclofenac-based, available as gels, patches, and solutions. These products are indicated for conditions like superficial joint osteoarthritis and acute musculoskeletal injuries. Studies show that topical NSAIDs have similar or lower rates of adverse events compared to oral forms, even in older adults and those with comorbidity. However, they still carry warnings for potential cardiovascular, renal, and gastrointestinal risks. Lidocaine patches are a mainstay for neuropathic pain, such as postherpetic neuralgia and diabetic neuropathy. Lidocaine works by blocking sodium channels on sensory nerves, reducing abnormal pain signals. Both over-the-counter and prescription-strength patches are available, with the 5% Lidoderm patch and 1.8% ZT Lido system approved for postherpetic neuralgia. Studies show that lidocaine patches can be as effective as oral medications like pregabalin, with fewer systemic side effects and improved quality of life for patients. Capsaicin, the compound that gives chili peppers their heat, is used in topical gels and patches for pain relief. It activates TRPV1 receptors on nerve fibers, initially causing a burning sensation but eventually reducing pain through desensitization. Low-concentration capsaicin creams are available over the counter, while high-concentration 8% patches are prescription-only and used for neuropathic pain. Although effective for some, capsaicin products can cause discomfort and require careful application to avoid irritation. In addition to single-agent topical analgesics, combination products are becoming more common. These may include mixtures of NSAIDs, lidocaine, ketamine, amitriptyline, or gabapentin, especially for complex pain conditions. Many of these are prepared by compounding pharmacies. However, evidence for their effectiveness is still limited, and more research is needed to determine their true benefits compared to standard treatment. Patients should consult their healthcare provider before using compounded products. Topical analgesics represent a valuable and evolving option for managing both musculoskeletal and neuropathic pain. Their local action, improved safety profile, and growing support in clinical guidelines make them an important part of modern pain management. Ongoing advancements in formulation technology promise even better delivery and effectiveness in the future. As research continues, patients and clinicians can look forward to more personalized and safer pain relief strategies, ensuring that topical analgesics remain a cornerstone of comprehensive pain care.